My name is Drew Habler, and today I'm going to be discussing euthanasia and why I think it should become a standard practice within medicine whenever it is medically necessary. So, first, it's important to discuss what euthanasia is and when it should be considered. So, euthanasia is a medical procedure that is used to end the life of a terminally ill patient, and this is a procedure done through physician administration of lethal drugs. So the first step is anesthetics to make the patient fall asleep, followed by a paralyzing agent so they can't move, and then finally potassium chloride, which ultimately makes the patient's heart stop. So it's a very peaceful death and it's not painful. The patient won't feel any pain and they're asleep and paralyzed for it. And it's only considered when a competent patient expresses the desire to end their life when they're facing an incurable disease which medicine can no longer cure. So, why do I think euthanasia should become a standard practice within medicine? Well, for one, it respects individual autonomy because it gives individuals an exit strategy that is dignified when all other treatment options have been exhausted. So, no other medical options allow the patient to become better or recover from their illness. And if they express a desire to die, which I'm sure we all know some people, or maybe we maybe know some people, or maybe some grandparents that may have had an illness and at some point they expressed a desire to die, even if medicine offered, maybe they didn't quite offer a cure. But it also allows for painless relief from unbearable suffering and supports human dignity because it allows people to make decisions about their own body and allows them to make dignified choices about their health. So, what's the relationship between euthanasia and autonomy? It allows people to live their lives with dignity and control, and euthanasia allows people to end their lives with dignity and control because it allows individuals to make decisions about their own body. And in everyday life, everyone already expresses some form of autonomy. Within medicine, this is usually the examples I can think of are through birth control or through various different medical procedures that might not be necessary for the health of the person. They choose to undergo them anyways. And people already have the right to express autonomy in their everyday lives. So if people are ill and they're approaching the end of their lives anyways, they should have the ability to choose to end their life if they feel it's appropriate and if their situation deems it appropriate. And as I was saying, people already have the right to express bodily autonomy, and so they should be able to choose the time and manner of their death if their situation, if their illness deems it appropriate, and is performed by a physician who can bring a peaceful death to the suffering of a patient, which ultimately will bring an end to prolonged suffering, because usually the patient is extremely ill when it gets to the point that euthanasia is discussed. So, is it really a compassionate act? Euthanasia is a compassionate act because it offers individuals a peaceful death and protects them from a painful or an agonizing death. As I was stating in the first slide, it's a procedure that makes the patient fall asleep, followed by more or less paralysis, and then the heart to stop. So it really is a peaceful death and does not bring any more pain to the patient than they may already be experiencing. In fact, it'll probably mitigate that pain when they're in the process of passing. And because of this process, it values the sanctity of and the inherent worth of every human being because it makes sure that they don't die in pain and that they have a peaceful and they're asleep when they pass. So it's important to discuss the relationship between euthanasia and human medicine and veterinary medicine just because it's been accepted in veterinary medicine for a long time. And for many decades, they've been using drugs as a mean to end the lives of pets that are extremely sick. And veterinarians for a long time have been entrusted with the responsibility of euthanizing animals whenever they deem it medically necessary. And pet owners will often opt for euthanasia because it guarantees their pet a peaceful passing in the face of illness. And it will ultimately allow the peaceful passing of their pet, and it will allow the owner to rest better or maybe just feel better knowing that their pet was not in pain when they passed. And it's often seen as a humane option just because of the procedure and how it works within the pet's body. And so ultimately, it's important to recognize the parallels between human and animal euthanasia because we can have a more comprehensive understanding of end of life ethics and we can understand and support individuals who have a desire to die. For example, if we see a pet that, has late stage cancer and they're only given maybe a couple weeks left to live, but we know that it's going to be a painful death, a lot of the times, I would say the majority of the time, just because I've grown up around veterinary medicine, patients will say, or patients will, their owners will want to euthanize their pet just because they know it's the peaceful and humane option and it's dignified. And so, if we understand that thought process that owners are going through for their pets, then we'll better be able to understand what family members are going through, and then especially what the patient themselves is going through. So there's a variety of arguments against euthanasia, and the main ones are that legalizing euthanasia could lead to involuntary abuse of euthanasia, especially within vulnerable populations such as the elderly or disabled. And this is especially true, especially with the elderly, because maybe they feel that they're a burden on their family. Maybe their disease is a financial burden, or maybe they are disabled, so they're not able to perform certain tasks for themselves. So they may feel that I need to die in order to help my family. And this is not the right headspace to be in at all when talking about euthanasia. It needs to be the patient wanting to end their life. Maybe they felt that they've lived a whole life and that they don't want to deal with the suffering that their illness brings anymore. And another argument against euthanasia is that the existence of palliative care makes it an unnecessary procedure. Just because palliative care exists for people that there's maybe no longer medical cures for their disease, so it allows them to live comfortably throughout the duration of their life, especially when we're talking about extremely ill or elderly people. And so there's a couple rebuttals against this. We can avoid abuse by implementing safeguards for euthanasia to protect these vulnerable patient populations. And I would say this needs to be extensive assessments by medical professionals, and there needs to be a clear set of criteria for euthanasia. I would say extensive assessments should be multiple doctors. There probably should be some psychiatric evaluations, just to make sure that the person it wants to undergo euthanasia because they themselves are sick and they felt that they've lived a full life. They no longer want to deal with the pain that their illness brings, and they're ready to pass. And if they don't, and they also have to meet certain eligibility, like maybe I'm not sure how this would look, but with certain diseases it can maybe 6 months left to live or a year or anything within that realm. They're very sick and they're not going to recover. Modern medicine no longer offers a cure for them. And this has to do with palliative care, because palliative care does exist for people that can no longer receive medical treatment because all their treatment options have been exhausted. And if death is certain, people should have the ability to end their life on their own terms. So, and this brings up another question: when do veterinarians perform euthanasia? They only perform euthanasia after a thorough examination of the pet's health and assessing whether or not it is in the best interest of the pet to alleviate both pain and suffering. I can go back to the example that I was talking about with a dog that has severe cancer. They're going to be in extreme pain. They're not possibly going to be able to move around. They're not going to be able to eat or drink. They're just going to have to sit in the hospital and more or less be on various drugs to try to bring comfort to them until they ultimately pass. So at that point, that's when a veterinarian would discuss euthanasia with the owners so that the owners can understand whether or not euthanizing their pet so that their pet no longer has to deal with the pain and suffering is in the best interest for both themselves and their pet. And this is only considered when all other medical options have been exhausted and no options remain to treat the disease. It's just going to be treatments and drugs that will help the patient feel better but not necessarily cure the disease. So what can we conclude? Euthanasia is not a decision that can be taken lightly, and it should only be considered under extreme circumstances with people that are extremely ill and they're unable to recover. And euthanasia allows individuals to make personal decisions about their own bodies when modern medicine no longer offers a cure to their illness. They have the autonomy to choose how they want to die and when they want to die, ultimately after they have had autonomy in every other aspect of their life. So it allows people to have control over everything. And because it allows people to have control, and just given the procedure and how painless it is and how morally it is correct, because it does not bring pain or suffering to the person that is dying. In fact, it relieves that pain and suffering. Then I believe it should be implemented as a standard practice